Hello and welcome to my project. Today I will be talking to you about WPW, Wolff Parkinson White syndrome. WPW is a heart condition. It has to do with the heart. But before I get into more details about it, I just wanted to kind of explain what a normal heartbeat looks like. In this photo, you can see the pathways that your blood flows through in order for it to contract and to pump your blood. In your right atrium, there is a massive tissue called your sinus node, which controls the rhythm of your heart by producing electrical impulses. These electrical impulses move from your atrium to your ventricles, causing the blood to pump and your muscles to contract. If you look in this photo, you can see the AV node in between your atrium and your ventricle. This is usually the only pathway for signals to travel from each chamber. This slight delay allows for ventricles to fill with blood. When the electrical impulses reach the ventricles, muscle contractions pump blood to the lungs and to the rest of the body. WPW patients their blood still flows through the heart the same way, except they have an extra electrical pathway that connects from the atria to the ventricles. This is obviously an electrical abnormality within the heart. With this extra electrical pathway, it allows electrical impulses to bypass the AV node altogether. When the electrical impulses use this detour through the heart, the ventricles are activated too early. The extra electrical pathway can then cause two major types of disturbances. Sorry, I think I got cut off there. I'm really bad at working this video system thingy. Anyways, the first major type of disturbance is called a looped electrical impulse. And this is when the electrical impulse either travels down the normal or the extra pathway and then up the other. This creates a type of loop, I guess you could say. This condition sends impulses to the ventricles at a very rapid rate, which results in the ventricles pumping blood really, really quickly, which causes a really rapid heart rate. The second type of disturbance is called disorganized electrical impulses. If electrical impulses don't begin correctly in the right atrium, they may travel across the atrium in a disorganized way, causing what is called an atrial fibrillation. The disorganized signals and the extra pathway of WPW can also cause the ventricles to beat faster. As a result, the ventricles don't have enough time to fill with blood and can't pump enough blood to the rest of the body. Wolff Parkinson White syndrome was first discovered by three doctors in 1930. Wolff, Parkinson, and White. These doctors noticed ECG patterns in healthy people who had short bursts of increased heart rate. In 1933, other doctors noticed that the reason for this irregular rhythm was a faster passage of impulses traveling through the ventricles. And then in 1944, doctors confirmed the presence of an extra pathway. The electrical pathways in individuals who have WPW is mostly always present from birth. It is associated with some congenital heart diseases and is an abnormal gene. WPW is a relatively common condition affecting between 1 to 3 in every 1,000 people generally. Although sometimes the extra electrical connection won't cause any symptoms until later on in life and may only be picked up by an ECG, an echocardiogram test that is carried out for like some other type of reason. That's sometimes the only way that the doctors actually pick up on it. In this case, further tests will be done to. The symptoms of WPW patients are due to increased heartbeat. The number one most prominent symptom in these individuals is a feeling of fast, fluttering, or pounding heartbeats, which are called palpitations. Honestly, you can literally see their heartbeat out of their chest. Also, patients may have a feeling of shortness of breath, dizziness or lightheadedness, fainting, fatigue. There are three main ways for doctors to be able to diagnose an individual who has WPW. These three ways are through an ECG, an echocardiogram, a portable ECG, or electrophysiological testing. First, the ECG is a sensor that attaches to your chest and your arms. It records the electrical signals that travel through your heart, and the patterns among these signals indicate the electrical pathway. The second way to diagnose an individual with WPW is through a portable ECG. It's exactly like a regular ECG, except you bring it home with you. It would be called a Holter monitor, and it recognizes your heart rate activity, your electrical impulses for 24 hours or 48 hours, whatever it may be, that the time that the doctor gave it to you. It records the events of all the symptoms that you experience the whole time you have it, so the doctor can see what it's like on a normal day with normal activity. There are a lot of individuals who have WPW and they can go a lot of their life without being treated. The number one thing that would obviously happen is their heart rate would increase. There could be potential fainting. Those are the two most things that happen to most people, but if it is left untreated and it is very serious, there is a possibility for death if it is untreated. But like I said, that is very uncommon. Like I said in the slide before, it kind of depends on the severity and the frequency of the episodes of the individual who has WPW. You may have an extra pathway in your heart for many years, and you may not have symptoms. Therefore, you probably don't need any sort of treatment. Individuals who do need treatment, though, the main goal is to obviously slow the fast heart rate and to prevent future. The first type of treatment that I'd like to talk about individuals who have WPW is the least invasive. These are called vagal or vagal, not sure how you say it, maneuvers. Anyways, this type of treatment is, like I said, the least invasive, and it's the first thing that all doctors will hopefully do to be able to help try to reduce the heart rate of the individual who is experiencing rapid heart rate. These things would include bearing down, so I guess like squeezing and trying to make it look like you need to poop, like you're having a bowel movement kind of, splashing water on your face, putting an ice pack on your face, something like that. This affects the nerves, or this affects a nerve that helps regulate your heartbeat called the vagus nerve. Yeah, your doctors would recommend this, and this would be the first thing that they would try to do to get you. The next treatment that doctors would try to reduce your heart rate would be medication. They would try injecting some sort of anti-arrhythmic medication, which is medication that can slow your heart rate down. If that doesn't work, doctors would try cardioversion, which is when they use paddles or some sort of patch on your chest to electrically shock your heart and store your normal rhythm. Cardioversion is typically used when maneuvers and when vagal or vagal maneuvers and medications are not effective. The last and final treatment that I would like to talk about of individuals who have WPW is the most invasive. This is called radiofrequency catheter ablations. This surgery would only occur to individuals who have very severe and frequent episodes of WPW, when their heart rate is increased very often. Through this catheter ablation, you would put a catheter, which is a flexible, small tube, in through one of your large veins, which usually goes through somewhere by your armpit or it usually happens through your groin, and it's threaded through your blood vessels and into your heart. Electrodes at the catheter's tip are heated to destroy the extra electrical pathway in your heart, which causes your condition. Radiofrequency ablation permanently corrects the heart rhythm problems in most people with WPW syndrome. With this being said, with my next slide, I would like to explain a little bit of a personal situation of an individual I know in my life who has had a little more extreme issues, or a little more extreme, I guess, problems than the most common individuals with WPW. That person is my bro, Justin O'Coin. He was diagnosed with WPW when he was 7 years old after swim class. I remember it like it was yesterday. He got out of his swim class and he said to my mom, "Mom, I feel like, my chest is my heart is gonna explode out of my chest. I don't know what this feeling is. It feels so odd." And he said there was just so much tightness in his chest, and he just felt like his heart was going to explode out of it. And so my mom looked at him and she said, "Oh my God, I can literally see your heart pumping out of your chest." Like, it was just the weirdest thing. And so, obviously, being a mom, just completely freaked out. And so we brought him to urgent care. He got rushed to the hospital so quickly. Um, it was absolutely crazy. And they took his blood pressure and his heart rate, and on a normal human being, on a normal child, on a normal 7-year-old, I guess, your heart rate is usually between 70 and 110 beats per minute. Now, when they took Justin's heart rate, his heart was going 250 beats per minute at the age of 7 years old. That is not okay. He was rushed to the hospital and was given a drug called adenosine. That was to bring his heart rate back to normal. Then, at that point, they did a whole bunch of tests and he was diagnosed with WPW. Because of that, once after that all happened and he was done with the doctors, they gave him 2 different kinds of medication to take every day to make his symptoms not happen and to hopefully reduce the amount of episodes that he had. They were called flecainide and sotalol. His doctors told him that there were a few things that he could do. Justin's really active. He was dancing and he was, doing so he would, no matter where he was, if he was at school, if he was in his classroom, if he was at dance, if he was at a birthday party, and his heart would start and he would, be running around, or sometimes it would even happen when he was watching TV. It was like, "Oh, my heart's beating fast again." And no matter where he was, in the middle of public in the grocery store, he would find a surface and he would do a headstand. And every single time, it always worked. It always helped him out. And that was his kind of cure. It was his one thing that really, really helped him. Though the very slim times that it didn't work, and it got really, really bad and it would stay for a really long time, we would have to bring him to emerge and they would have to flush him out with adenosine. Anyways, he went and did his first surgery. And when he went to his first surgery, they went in, did the surgery, and when they got back out, they found out. Enjoy the video and the link that I